I'm a registered physiotherapist. I graduated 33 years ago from university and have been practicing clinically over the last 33 years. Have had three really kind of tracks within my clinical practice. The first one was very much in orthopedics, and I'm a Mackenzie credentialed physiotherapist, so I take a very mechanical approach. And then I became a pelvic health physio about 20 years ago. And then probably about 12 years ago, I really started to look more into pain science and a biopsychosocial perspective. Now, in Canada, which is where I'm from, we don't have the same types of specialized programs that you have. So master's programs that sort of grant specialty titles. And so in Canada, I would be seen certainly as a generalist physiotherapist with a specific practice focus on orthopedics, musculoskeletal health, and pain science. My passion at this point, I have a real heart for physiotherapy, and if we look at where physiotherapy has come over the last 100 years, really, and some of this comes from Dr. David Nichols in Auckland, New Zealand, who actually wrote a book called The End of Physiotherapy. And that sounds a bit macabre almost, and fatalistic, I guess is the word. But we really have come to a point where physiotherapy needs to change. We need to move away from the body as a machine type of paradigm into really a much more holistic biopsychosocial perspective. And I think in Australia, that is very much appreciated from a theoretical perspective. I think you're ahead of us in Canada. However, the implementation of that into clinical practice is still a challenge. So my passion really is to help clinicians really embrace a biopsychosocial perspective in a very practical way as a clinician. Wow, so a career highlight was probably to be a keynote speaker at the first World Congress of Abdominal Pelvic Pain in Amsterdam in 2013. And so it was probably one of my first big keynote addresses at an international conference. And I was the second speaker up right after the president of the IASP Association. And this was 2013. So talking about central sensitization and a biopsychosocial perspective was still pretty new, particularly in pelvic health and pelvic pain. And I will never forget that, my whole talk was about central sensitization and the integration of that into clinical practice for physiotherapists and overactive bladder and pelvic pain. And the president, I can't remember his name, and I should, but I can't, at the time did a whole half-hour talk on how central sensitization was not the correct term. What we really should use is central pain mechanisms, because it's a much broader term and includes what's happening in the dorsal horn of the spinal cord, but also in the brain and the rest of the central nervous system. So I literally had to stand up. Thankfully, it was the darkest hall. I couldn't see anybody, and I had to just flip my words on the go. And it went really well. So that was probably the highlight for me. But I've done lots of great research that I'm really proud of as well. But that was fun. That was interesting. All right, so what it really boils down to is we've got some great research. We have had research really knocking at our clinical door over the last 15 to 20 years that a broader focus is needed, that we need to treat the whole person. But it's translating that knowledge into clinical practice that's really the challenge. And so I think, again, Australians really have pain education kind of figured out and nailed down. And I think most clinicians probably integrate that into their clinical practice. But then translating the knowledge of then how to address the sensitive nervous system versus just treat the tissues is often where we get stuck. So I'm hoping that we can start to add some knowledge, some skills, some understanding of that, translating that skill into clinical practice.